Hi and welcome to this live Zoom. And let me introduce me my guest Andrew Koutnik from Florida, US. Hi, Andrew.
Hi, everyone. Honored to be here.
Thank you, Andrew, for being here with us. You are now in Florida, and you have afternoon. We have evening here in Italy. I introduce also a couple of words to introduce you to my community. Dr. Andrew Koutnik is a distinguished scientist whose groundbreaking research bridges nutrition, metabolism, exercise science, and human performance. Diagnosed himself with diabetes type 1. It's the topic of the today live Zoom. Himself, Dr. Koutnik passionately applies his expertise to help both athletes and patients with diabetes effectively manage their condition through targeted nutritional strategies and lifestyle adjustments. His collaborations span leading institutions, including University of South Florida Morsani College of Medicine, the Institute of Human and Machine Cognition, and Samsung Diabetes Research Institute. He worked a lot of time also with Dominic D'Agostino, he told me. And we know we are going to meet in San Moritz at the International Keto Liver Congress. He actively works with elite athletes, military personnel, and individuals striving for optimal performance and health despite diabetes type 1, translating cutting-edge metabolic science into practical, empowering solutions. And that's what we want to give our followers today, Andrew, with your expertise. So as I told you already, I collected a couple of questions for you from my fellowship. And we are, as we discussed before the beginning of our life, that in Italy it happens as it happens in America and almost, I think, everywhere, that type 1 diabetics get informations. You have to eat carbs, you can eat what you want because you have, after that, you have insulin. But maybe this is a kind of Armageddon counseling, isn't it, Andrew?
It's not helpful. The idea that carbohydrates are required is false. We know in metabolism and physiology that carbohydrates requirements are zero to live healthy, normal lives. The inclusion of carbohydrates is an expected normal part of many cultures and diet. However, particularly in metabolic disease, chronic metabolic disease, and even more so in type 1 diabetes, but also type 2 diabetes, nutrition has a major role in disease management. In type 1 diabetes, carbohydrates are the hardest nutrient to control in the diet, often leading patients to high and variable blood sugar levels, which often makes patients feel like they're living on a roller coaster. And far from optimal, as these high and variable blood sugar levels lead to not just chronic complications of damage of the eyes and the kidneys, the nerves, but it also can affect the quality of life of patients living with disease at every meal of every day. And it just so happens that carbohydrates are the most difficult nutrient in the diet to optimize. So many people have found success removing them.
And Often I have to really to smile because we have some nutritionists in Italy who are saying that if you eat proteins, and I mean, I hope they are meaning so animal proteins as meat, eggs, and fish. And they have also a gluconeogenetic effects. What's your experience with, I mean, now a lot of protein in your diet and more than needed, more than 2 grams per kilo body weight?
So the reason someone may want more protein in the diet is because it helps body composition. So it helps muscle size, growth, recovery, particularly for athletes. It protein in the diet also helps people feel full. So after they eat a meal, they may be less hungry. It's a really powerful tool and an essential nutrient in the diet. One thing you bring up is the potential glucose elevating effect of protein. Now, there have been studies since 1980s that have shown that the impact of carbohydrates on glucose increases in the blood. So when you eat carbohydrates, it elevates blood sugars rapidly within 30 minutes of consuming that food. Most of the glucose elevating effect that the carbohydrates has occurred. Protein only has about 40% or 2.5 times less of the glucose elevating effect and insulin requirements of carbs. It's much less. On top of that, the glucose elevating effect is slow and stable for multiple hours, whereas carbohydrates is very rapid and immediate. And why that's so important to appreciate is that, yes, protein does affect glucose levels, but only a little bit compared to carbohydrates. But in type 1 diabetes, you have to control the food you eat and the lifestyle you have with insulin that's often also very slow. That's why carbohydrates are almost never able to be matched by how rapid carbohydrates are compared to how slow exogenous insulin is. But exogenous insulin that we take as people with type 1 diabetes it can match the slower speed of protein, allowing for glucose to be better managed. So yes, it has a glucose elevating effect, but it's small, but it can be managed with the tools and technologies we have.
If it would be dangerous, I mean, we spoke about Richard Bernstein, 91 years old, our colleagues, and diabetes type 1 since he was 12 years old. And he's eating a protein-rich diet and has a very, very low HbA1c. And he managed, I think he doesn't need much insulin units to manage it.
That's important because to your audience, Richard Bernstein is really a pioneer in the world of diabetes in general, but also type 1 diabetes. Most people with type 1 diabetes are expected to live 11 to 18 years shorter than those without type 1 diabetes. And if you accept and understand the average lifespan, depending on the country,
Yeah.
Richard Bernstein is currently living 25 years beyond his expected life expectancy as someone living with type 1 diabetes. Richard Bernstein is very public about how important glucose control is and living a healthy, long life with type 1 diabetes. And he's very open and public about how he manages it with a low carbohydrate, higher protein form of a diet. And he is really a living testament to someone who has achieved that, but has also lived longer than most people, even without type 1 diabetes.
Even without. I agree with you. Can type 1 diabetes develop after a period of intense stress?
Type 1, yes. Yes. Type 1 diabetes is an autoimmune disease, but how the autoimmunity happens is often due to a stress. That can be an infection. That could be an infection or some type of immunological or immune system
Yeah.
change that sickness or things like obesity can contribute to. So for a long time, we believed that type 1 diabetes was happenstance. So meaning it just happens, but we don't know why. But now we are starting to understand that there are risk factors that beyond just family history.
Yeah.
Things like obesity are now explaining up to 25% of all cases of type 1 diabetes. We know that infections can be triggers for autoimmune attacks. And so but all these are forms of stress on the body.
And what was your case, Andrew? Did you have an infection or?
So I don't entirely know what the trigger was for me. Now, I had adolescent obesity from all the way up to about 15 years of age. I was obese. And so that might have increased my risk for developing type 1
Yeah.
diabetes because I have zero family history. However, I had lost weight independent of type 1 diabetes a year prior to my diagnosis that had nothing to do with it. And so when I got diagnosed, I was actually normal body weight, but I was also doing a lot of things that might have put me at risk. I was consuming certain types of foods in my diet that had a lot of, like, I was drinking a ton of diet sodas, almost like a 12 pack a day.
Really?
At one point I was, yes. And so I don't know if that actually increased my
Yeah.
risk, but I can't help but look back at that scenario and think, I don't have any family history. I'm no longer obese. I'm exercising and living a healthy lifestyle. How did I get this? And I can't help but think maybe some of these lifestyle choices of consuming excess amounts of those type of drinks might have put me at risk. But the truth is that I don't entirely know. But we do know that there are a number of things that do put people at risk for this disease, like obesity.
Yeah. And can people with type 1 diabetes practice intermittent fasting or also prolonged fasting?
Yes, it's actually common. Most doctors or clinicians will never recommend intermittent fasting, but with people with type 1 diabetes, we know that food, particularly high carbohydrates, both sugary and starchy carbohydrates, are very difficult to manage with insulin, not the type of insulin that someone who has it produced from their body may make, but the type that we as people with type 1 inject
Inject, yeah.
artificially
Yeah.
outside the body. And so intermittent fasting is a really powerful tool to prolong the window of prolong the timeline where food isn't constantly bombarding or entering the system. And that may allow for relief for patients with type 1 diabetes to go extended windows without these difficult and uncertain variables like food in managing their diabetes.
And can individuals with type 1 diabetes become insulin resistant?
This is a very controversial and interesting question. It is not appreciated by much of the world or scientific community that most people with type 1 diabetes already have insulin resistance. Because in type 1 diabetes, you have to inject insulin outside the body, whether it be into your stomach, your shoulder, your arm. The route of administration causes the peripheral vasculature, so your blood vessels that are near your muscles and fat, not so much your internal organs, are exposed to very high levels of insulin immediately. Analogous or similar to what happens in type 2 diabetes. So there have been over 30 studies looking at insulin resistance in type 1 diabetes, and all of them across all age groups have shown that people with type 1 have some degree of insulin resistance just based on the exogenous artificial route of administration. Now, you can't do anything about that in type 1 diabetes. But what you can do is lower the total insulin load you have to take. Because just like in type 2 diabetes, higher insulin values are associated with dose dependent elevations in insulin resistance. So if you can lower the total amount of insulin that's being injected into your body, you would theoretically be able to lower the total amount of insulin resistance your body is at risk for in type 1 diabetes. Now, what you may also be asking about is something called double diabetes,
Yeah.
which is both type 1 and type 2 diabetes. That form of diabetes is the combination of obesity, insulin resistance, and high and variable glucose values. So in that situation, someone with type 1 diabetes is at even higher risk. And it's much more common, unfortunately, Christina, today, because the rates of obesity in type 1 diabetes, a disease that used to be only in normal or under body weight individuals, people with type 1 diabetes now match the rates of obesity in the US population, which is record levels. What's most concerning about this is that these rates have increased faster than the general population. And the reason that is because now the recommendation is to inject more insulin to control blood sugar levels, which reduces the risk of eye damage, kidney damage, nerve damage, just to get glycemic control. The problem is that they're not considering interventions to control glucose levels that also lower or decrease insulin. An optimal therapy in type 1 diabetes for patients is to have normal controlled glucose levels with low insulin. That combination is most similar to what a healthy patient would have without type 1 diabetes.
It's clear. Thank you. For people who use an insulin pump, diabetologists often tell young patients they should eat carbohydrates. Is this always necessary?
Never is that necessary. In fact, I use an insulin pump right now, and I consume less than 50 net carbohydrates per day in the form of spinach, cauliflower, low, low glycemic impact carbohydrates with high fiber. So, no, the rules are not different if you're on a pump. Those are recommendations given to patients because they believe
Yeah.
that they have to have carbs,
Yeah.
which they don't.
And do you eat also milk products like cheese or yogurt?
It all depends on how my blood glucose and insulin responds to it. For the most part, I do okay with those type of foods. But some yogurts have hidden sugars in them. So some yogurts actually will include forms of sugar, particularly in the United States or America. They will put sugar based ingredients and give it a different name. So it
Ah,
doesn't, so it's not on the label like sugar, but it could be maltodextrin, a wheat, a honey, agave, a
but
barley.
but when I speak about yogurt, for me it's yogurt, a natural full fat yogurt without anything other,
Right.
only that. So a
Yeah.
plain
Yeah.
white yogurt. And with a normal plain yogurt, how does what happens with your glucose?
It depends on the yogurt. So if I were to get a pure form of yogurt, depending on the source of it, I can usually handle that well with insulin. Some yogurts,
Yeah,
particularly that have higher whey protein content, whey protein goes in faster than most proteins do. So you often have to inject rapid forms of insulin to
yeah,
manage it, but it's manageable. And many people with type 1 do it. It's something that you have to trial and error
yeah,
or a test out in type 1 diabetes to see how you respond. But yogurt for most people is a extremely healthy food option if it's the type you're describing, Christina, without
yeah. No,
excess.
of course. No, of course. I mean, so a couple of weeks ago, I was in the supermarket and I was struggling in finding my full fat Greek yogurts because there were, hundreds for light yogurt products. And then I was really desperate. Where is my full fat Greek yogurt? And then I found it after a while. And there were two women from the supermarket, and I asked them, "Excuse me, why do you have so a lot of light yogurt products?" And the answer was really appalling. It was because they told me it's because all the people are on diet. And so they associate light with diet. It's terrible. It's everywhere the same. It's really,
And it not even the diet that may work for someone. It is important to appreciate that there was a huge push for low fat foods to reduce the calories in food,
uh,
thinking it would help people reduce weight. But since those recommendations, people have only gained more and more weight.
yeah,
So, what is often problematic is not appreciating that there is different strategies for different people, but lower carbohydrate, ketogenic food strategies are incredibly powerful tools to live a normal, healthy, long life, particularly if you have a chronic medical condition where carbohydrates directly inhibit the ability to manage the disease effectively.
thank you for your statement, really. Um, My diabetologist, says one follower, insists that I should eat at least 20 grams of carbohydrates per meal. The answer is always the same. Not necessary.
It definitely not necessary at all. And interestingly, diabetologists, endocrinologists would know this better than anyone because medical training for endocrinology and diabetology, one thing they often learn about is fasting. They know that fasting lowers insulin, increases ketone bodies, and that's a normal physiologic state that people go in and out of. In type 1 diet, or even outside of type 1 diabetes, low carbohydrate ketogenic diets model a lot of the physiology of fasting without the caloric deficit. So without 0 calories, which allows people to maintain that type of physiology and in essence forever without. So many endocrinologists and diabetologists often need assistance in helping take the medical education they had and reframing it to be up to date with the scientific evidence today, which shows that you don't need any carbohydrates to live a normal life. In fact, our research team published the longest ever longitudinal report of a patient with type 1 diabetes consuming a ketogenic diet. That report was 10 years. A patient who consumed a confirmed ketogenic diet, maintained body weight, maintained calories, and maintained activities. So we were able to look at just the food-based effects on multiple measurements of health. And what we found is that when looking at cardiovascular health, the number one cause of death for people with type 1 diabetes, that patient had not just as good measures, well, they had not only better measurements than those living with type 1 diabetes, but often they had better health than those without type 1 diabetes. And that's the most long-term assessment of a ketogenic diet in any disease, but it happened to be in type 1 diabetes, a disease with much more progressive, advanced cardiovascular disease risk. And it showed that this diet, very low in carbohydrates, was able to maintain not just optimal health, but health that was often better than people even without type 1 diabetes.
There is the same in diabetic type 1 people to have those roller coaster from the blood glucose levels, isn't it, Andrew?
It is expected and normal for most people with type 1 diabetes to have high and variable glucose levels. That should not be your goal as a patient with type 1 diabetes. I hope everyone realizes that normal, healthy blood sugars, 1, is achievable. 2, should be what we strive for. But 3, is and should be accepted. It should not be accepted that high and variable glucose levels is normal, because those high and variable glucose levels, those lead to chronic complications, including eye damage, kidney damage, nerve damage, 10 times higher cardiovascular disease risk. We know that in children diagnosed with type 1 diabetes, that within 3 years, they see neuroanatomical changes in their brain
Three,
associated.
3 years, only 3 years.
3 years, you can look at studies of patients,
Yeah.
children, by the way, children with type 1 diabetes, and see neuroanatomical changes from MRI scans. They are actually showing that the elevation and dysfunctional glucose levels are damaging developmental parts of the brain, causing patients with type 1 diabetes, even in childhood, to see delayed development, lower cognitive scores, and an increased risk of anxiety and depression that's often tenfold higher than the level seen in general population, with over twofold higher risk of suicide. I say all this to say that glucose levels are associated with all of those variables. And the one thing that's different for patients with type 1 diabetes is the inability to control glucose because they don't produce insulin. But if you can do a therapeutic strategy that allows you to maintain glucose levels just like someone without type 1 diabetes, you are removing the risk associated with all of these complications and dramatically lowering the incidence or likelihood of developing one of these impaired quality of life effects that are often believed to be expected in this disease. And I believe you should never accept that expectation.
I agree fully with your statement. And I suffer always with the people who has HbA1c from 6.97, and they are being told, no, it's good so. It's terrible so.
The reason they say that is because there is a belief that people with type 1 diabetes can't get tight glucose control. And so they think, well, how do we get better glucose control without running the risk for a very low blood sugar or hypoglycemia?
Yeah.
And so they accept running higher blood sugars, even though they know that those higher blood sugars will lead to chronic complications. Any study that has looked at complication risk associated with glucose control, cardiovascular disease, mortality, kidney disease, all of these show a dose-dependent elevated risk with higher and higher glucose levels.
Yes, but it's terrible, Andrew. It's really terrible. I mean, we doctors are looking at an Armageddon and doing nothing. Excuse me. We are only accompanying the people with a lots and lots and lots of I mean, insulin, statins, and a lot of meds to treat complications. Then you
It
have the meds to treat neuropathy. Then you have the meds to treat depression, as you told us. So many times more depression, anxiety, double so much suicide risk. I mean, it's really terrible. And we have the study also from a ketogenic diet in bipolar disorder or schizophrenia or major depression who are getting better. And to ignore those studies is really, I mean, it's not understandable. It's not, I really, I can't understand it. I'm so appalled, really.
one major barrier, Christina, to healthcare professionals diabetologists,
Yes.
endocrinologists, dietitians, nutritionists, and providing help to patients using lower carbohydrate, ketogenic, or what we call therapeutic carbohydrate reduction, is that there were no guidelines that gave healthcare professionals the tools and resources to be able to manage type 1 diabetes patients. But an international team of researchers, clinicians, dietitians, certified diabetes educators, diabetologists, often living with type 1 diabetes themselves, came together over a 5-year effort to develop international institutional guidelines for healthcare professionals to safely and effectively guide patients on this journey. And that's with the Institute for Personalized Therapeutic Nutrition. I was one of the co-authors on this paper, along with a number of other individuals. And that should be an opportunity for healthcare professionals to read this document and become educated on how to help patients get optimal glucose control, especially if the patient enters your clinic asking to do this approach. They should be encouraged and guided on that journey, not told, don't do that. Just like one of your listeners asked, well, I was told I have to eat 20 carbohydrates per day. No, you don't. And here's a guide that teaches you how to do that safely. As we know, the evidence shows these diets can be healthy in safe ways to manage disease.
Yeah, that's the paper I asked you to translate in Italian, isn't it? Yeah. We're
Yes, that's
going,
it.
we are going to do it with a friend of mine. And thank you for your permission to help Italian people. we have to work on the receipt because Italian kitchen is a little bit different, but
Yeah.
we are going to do it. I'm looking now to some questions who arrived just now. And Maria Letizia is asking, how many years do you have diabetes type 1? 16 years?
Going on 17 years now.
17 years, okay. And then Andrea has diabetes type 1 since 5 years. He's now 42. And he started a carnivore diet. And before he was always a low carber. And in 1 month, he he has now an HbA1c from 5.6, and he's injecting insulin only at the evening. He wanted to ask you if if you think that it's possible for Andrea to keep on eating carnivore for him.
So, what he's describing is a phenomenon observed where, so let me answer his question first. If the diet is controlling your health, is allowing you to feel good and control the number one risk biomarker in type 1 diabetes, HbA1c, that is, by the evidence, by the data, the most important thing you can do, however you do it. So if you're able to do that with a carnivore diet, 2 thumbs up. If you were able to do that eating 5,000 grams of carbohydrates per day, I would say thumbs up.
Of course.
But you probably can't. And so you have to find the diet and nutritional strategy that allows you to accomplish that goal. So if someone's accomplishing that goal, I don't think anyone should tell them, don't do what's working. You should continue to do what's working for you. But he's also bringing up something very interesting. He said he was 42 years old. He had been diagnosed less than 10 years, which means he got diagnosed in adulthood. and he's only taking nighttime insulin. He's describing a phenomenon where there have been a number of case reports and case series actually showing patients, especially those in adulthood or those who were first diagnosed, going on very low carbohydrate diets, sometimes carnivore diets, and extending the honeymoon period
I
by
see.
which they don't need insulin. Now, I can't say this is common, but I can say that it has been reported numerous times. And we actually received funding by the National Institutes of Health in America. Myself and Harvard Medical School, we collaborated to develop a project to actually look at this in children. And so the reviewers at the National Institutes of Health felt it was an important enough and evidence-based question to actually give research funding to explore. So it's a real potential thing that we're trying to understand what's occurring here. But it looks like there is some initial indications that you may be able to extend the honeymoon, but we're studying it more to find out. But I think it was Andrea, it was who brought the question in.
Yeah.
You describe a very interesting phenomenon, and we're actually trying to understand more about that.
Fine, fine. I'm really glad. Michele, he February 21, he has been diagnosed with diabetes type 1, and he eats keto. He's sporty and makes also intermittent fasting, and he feels good, and he did never inject insulin, but since a couple of months the blood glucose is higher, and he has now they have another measure, HbA1c, from 52 to 70. Now it's not compensated. And he's asking, is it because of the glucagon, which the question I translate, which is implicated in the mechanism from synthesis of fatty acids? Is it an adaptation of my body that doesn't permit me to manage an optimal blood glucose? Why is it happening?
So this is actually analogous to something Andrea
Yeah,
reported.
yeah,
So when you get diagnosed with type 1 diabetes, your body has initiated an autoimmune attack on the insulin producing beta cells that control glucose levels. There have been some reports that when people immediately lower carbohydrates and go on something like a ketogenic diet, that they can control glucose without insulin, although it's not common. It's more common to hear this reported in adults because type 1 diabetes is slower progressing in adulthood. But no matter what, eventually, at least in theory, those beta cells will shrink and ultimately no longer be able to control the glucose effects of food and other aspects. And then patients have to inject insulin to manage glucose levels. And I want to be clear, this is not a failure of the patient. This is a normal progression of the disease that taking insulin requires patients to maintain normal glucose levels. It should be seen as a major achievement to be diagnosed with type 1 diabetes and even be able to manage it as long as they have without insulin and maintain normal glucose. But once glucose is unmanageable without insulin, you have to take it
yeah,
because elevated and variable glucose levels
yeah, yeah.
damage the body. So you have to control that. Yes, you have to take insulin, but you have to control that glucose level or it
Yeah.
will damage your tissues.
Do it, Michele. Take insulin. Very, very important. And we have still 8 minutes. And okay, here is another question. My brother with type 1 diabetes, um, they augmented him the carbohydrates to 130 grams pasta plus 30 grams bread at lunch, to breakfast, one bread with marmalade without sugar. I mean, I can't hear it, marmalade without sugar. It's just stupid, I mean, you think. And as a snack, one fruit or one yogurt or biscuit. At dinner, some bread. It's really, and they recommend him to follow this recommendation very exactly, because it's very important. I mean, it's really terrible. Here, he's injecting 4 times insulin a day. I don't really dare to imagine how many units. That's the standard recommendation they're getting.
So you are correct. That's standard in America also, but it's not required.
Uh,
So the most important thing to look at is, does that food help your family member, your friend, or whoever it is get normal glucose levels that allow them to feel normal and thrive? If it doesn't, you shouldn't do that. You should find what allows you to obtain normal glucose levels and thrive.
But, and you know what I think, excuse me, I interrupted you, but I think it's a little bit difficult for a type 1 diabetic because you have the skills, okay? But a normal person who is doing another job, okay?
Yep.
And you get those counseling, those recommendations, and then you have to decide for yourself, but then you stand alone. Also,
Yep.
with the mommies, with the type 1 kids, they stand alone.
So this is exactly why, if you go to andrewkoutnik.com, I
Yeah.
put a ton of free resources, all for free, for patients to find evidence-based information about type 1 diabetes. There is a 3-part blog on there that is long, but it covers this topic in extensive detail. And it is something you can send your healthcare professional. You know, not everyone is as educated as Christina is on these topics and is talking about these topics with the level of education she has. But this is what these webinars and, you know, opportunities to speak are all about. It's to provide the most up-to-date information we have on how to help patients thrive. And so I won't pretend that it is easy in a snap of the finger to just transform type 1 diabetes into normal glucose. But what I do want to tell you is that it's a step by step by step process that patients can, over time, learn the skills and then apply them to their life to get normal glucose control. There are hundreds of thousands of patients who have done this same thing. It's often about just taking the first step, but also educating yourself about this process and those you work with, providing them the resources that their traditional education, their traditional medical education probably didn't teach them. And so that's not their fault. They're there to help you, but you might have to help them understand this new information
Yeah.
because we know that this type of nutritional strategy has been around for over a century in managing type 1 and type 2 diabetes. We have walked away from this approach thinking that we could eat whatever we wanted and have normal glucose control. And that is not true. So we have to consider what does allow for a patient to get normal glucose control. And it often requires understanding how nutrition affects glucose levels and then actually understanding what works for you as a patient.
Yeah, and very, very fast and two question, because someone for nephropathic patients with a HbA1c from 60, what can he eat? Can we recommend a very low carb diet or a ketogenic diet with
So,
kidney sufferance?
so if they have kidney damage, so this gets complicated.
Yeah,
So in kidney damage, there is concern of higher protein diets. However, a gentleman named Thomas Weems, who I've worked with before, is an international expert on kidney disease. And he's talked a lot about how those recommendations to restrict protein may not be optimal if someone doesn't have kidney failure. So that's important to appreciate, that the idea that high protein diets are damaging to the kidneys
so
isn't
yeah,
evidence based.
yeah,
That's number one. Number
yeah,
two is that it, when doing a diet, the number one thing that damages kidneys in type 1 diabetes is high and variable glucose levels. So any approach to help that patient likely should start with managing glucose levels into the normal range as soon as possible, safely, of
yeah.
course.
And the last one, Sonia, is 50 years old. She's diabetic type 1 since the age from 9 years. She had diabetic retinopathy and one heart infarction. She has one stent and angioplastic, and she says that she eats more or less the same number of calories, but she has seen that she needs always more units of insulin, and she has very bad hypoglycemia. And with menopause, it got worse. And she asked, what can she do to 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 improve her state, and is she getting also insulin resistant? Menopause is impacting diabetic type 1 too.
Yes. So menopause is a stage where insulin resistance can often be a common effect
Yeah,
of
yeah,
that. It's a physiologic
yeah,
transition.
yeah, yeah.
So you guys have probably spoken about that before on your platform. And so I can't speak to her specific situation here, but what I can say is that if I was in this patient's position, I would be looking to, one, do what I could to, assuming they have type 1,
Yeah.
control blood sugar levels as a priority. Two, find a way to control body weight. Often in menopause, that's a very hard transition. It can often lead to patients gaining weight, even if they keep calories the same. They can develop insulin resistance. And so they have to find strategies, often nutritional strategies, exercise strategies, that
Yes.
help them get their body weight into the normal range. That'll help mitigate insulin resistance. Then they have to consider doing things that are not going to increase their cardiovascular disease risk, because they described having multiple conditions that are obviously associated with cardiovascular function. And so the number one risk factor for cardiovascular disease and type 1 diabetes is glucose control. That is the number one modifiable risk factor. Then you have things like blood pressure, triglycerides, resting heart rate. Things like LDL cholesterol are on the list, but they're much lower on the list. So the highest priority for patients, according to the evidence, is to maintain normal glucose control. That
But
is
you,
a
Andrew, excuse me, you mentioned LDL cholesterol.
you know,
I think it is a problem if it's oxidized because of the too high blood sugar levels.
so blood sugar levels at higher than normal range and more variability causes oxidative stress and inflammation, which are important parts of the plaque and atherosclerotic, so
Yeah,
cardiovascular disease progression process. And so if you don't get glucose levels into control, you are constantly placing your body at risk
yeah,
for the state by which plaque and
yeah.
atherosclerosis progresses.
But then for Sonia and for all the people in a similar situation, it's a very low carb diet to manage the blood levels. Maybe the first step to try and see if it works for her.
I think that all patients should find a way to control blood sugar levels. It doesn't have to be a low carb ketogenic diet. That just happens to be the best evidence based way that most patients have found success.
Yeah,
That's accessible to all patients. But maybe they're able to do it a different way. But whatever the way is, they should be pursuing it and finding a way to get glucose control. It is the number one risk factor for cardiovascular disease progression, and all 10 of the leading causes of death are
yeah.
elevated in type 1 diabetes, and glucose control is associated with them.
Thank you, Andrew. Thank you. Now, I know you have another appointment. Thank you for your time, really. And I'm sure it was very enriching my community. And maybe in fall, we can repeat a question and answer session with you that you find another day time for us.
Christina, I promise you I will do it. And hopefully one day I'll actually be in Italy with you guys to actually speak in person. It's one of the most beautiful countries. So honored to be here with you guys. And if you guys have questions, please send them to Christina, and I'd be happy to speak with
Thank
you
you.
guys again.
Thank you very much, Andrew, and thank you to all my community, and thank you to my interpreters, Enrica and Carmelo. Good night to all of you. Have a nice day to you, Andrew. Thank you. Bye.
Thank you.
Bye.